15, 16 years old. I started to get a lot of headaches and migraines. And after a while I got prescribed opiates, painkillers. Those not only helped with coping with the pain better, but also the emotional pain that I felt during this period. A few months after my dad passed away, it didn't take long until I was both physically and emotionally hooked, and I started ordering bigger quantities of other stronger painkillers online. I started using heroin laced with fentanyl. I first came here because I was on Suboxone after a few years on heroin, and I didn't find any viable treatments back home in Sweden.
He's been sober for 1 year, but has developed restless leg syndrome, a common and very painful side effect of overcoming methadone addiction. Exercise has helped him to some extent, but the pain dictates his life and makes it impossible for him to work and very difficult to sleep.
So when I got back home, I had this strong neuropathic pain in my foot and the right side of my brain. I've been basically on sick leave since I got home, and just been focusing on MMA and training and my mental health and yoga, ice baths. I've done all these things to cope with the pain.
1 year after the first treatment, he came back to our clinic to get treatment for the chronic pain.
The treatment consisted of rTMS, neurofeedback, ketamine, and psychotherapy. The patient responded very well to our treatment. The main part of the treatment was ketamine-assisted psychotherapy. This therapy has 3 parts. The first one is the preparation, where we speak with the patient, his intention, how he feels, what he wants to find in this journey. In the ketamine session, where he's all the time together with the therapist, he can talk about his experience. Always he will be checked how he feels and perhaps where he is in the journey. And then when ketamine finishes, so the very important part is his integration. So in this moment we speak what he discovered about him or the world, or how he felt, and what was the healing moment for him. And we try to integrate all what he has lived in this journey, how he can use for his daily life.
Before to start the treatment, we make a quantitative electroencephalogram to check the electrical cortical activity and the different brain waves. After the analysis, we find a brain with a moderate capacity to stay in relax and probably pain. After the complete treatment, we decide to make a new register of his cortical activity, but now under an ketamine infusion and psychotherapy. The register was made 10 minutes before, during, and 10 minutes after the infusion. In this register we find a brain more relaxed, in balance, in absolute power and interhemispheric connectivity.
So I came here for the treatment almost 2 weeks ago, and at that time when I came, the pain was unbearable. Now not only have I a lot less pain, I've also regained some motor function in my left foot, which was numb after my overdose in 2016. It's a lot less numb, so I'm really happy for that. And I think it's a combination of the ketamine and the rTMS. I'm able to cope with the pain in my right foot. I'm also able to use the left foot that I haven't been able to use. I feel more connected to myself, and I'm not gonna take that for granted. When I stay connected, that's when I feel at most peace with myself. You have one life and one chance, and No one knows what happens when we die, but we know that we have this time here, so it's best to make use out of it, because tomorrow is not a guarantee, so you have to take every day as a new blessing.